Good evening, everybody, and welcome to our webinar tonight. My name is Jenny Pearson. I'm a Education Officer from the Primary Health Network. Thank you all for coming. Before we go any further, I'd like to acknowledge the traditional custodians of the land we walk, reside and work upon. We pay our respects to First Nations people and value the continued connection to culture, country, waterways and contributions made to the life of our vast region. I'm coming to you from Enowan land tonight in Armidale in the Northern Tablelands. Our webinar is the Workforce Incentive Program Practice Stream webinar series. This is the first session in that series. We have Heidi Avery with us tonight who will be doing the presentation. I have Dr. Lee Fong who will be facilitating the Q&A at the end. So please don't hesitate to type in your questions, but we will do them after Heidi's presentation. We're also very lucky tonight to have Tessa and Mapara here from the department, and they're going to be observing and they will answer any questions that they can at the end. All right, this session is being recorded and will be put into our library tomorrow. Don't forget to fill out your evaluation at the end. We really like to get your feedback and it will automatically pop up at the end of the webinar. All right, I think that's all you need to hear from me. So I'll hand over to you, Heidi.
Thanks, Jenny. Welcome, everyone. So as Jenny said, we do have representatives from the Department of Health and Aged Care going through with this tonight. They will be present in the webinar as observers only and will only address specific questions if asked. So also please note that as this program is administered via Services Australia, any specific payment or calculation questions will need to be taken on notice and directed to them. So thanks ladies for joining tonight. I'll just quickly go through some learning outcomes. So we are going to be going through what is the WIP practice stream, who is eligible, how to apply for the WIP practice stream, how to maximise the practice's WIP practice stream payment, how to calculate your practice's WIP practice stream payment, and what is expected after approval. So because we do have a lot of content tonight, I will move through the slides fairly quickly and then we'll open it for discussion at the end. So let's get started. So the WIP practice stream encourages multidisciplinary and team-based models of care. The program provides financial incentives directly to the practice to engage a range of health professionals, including practice nurses, registered nurses, midwives, enrolled nurses, Aboriginal and Torres Strait Islander health practitioners and workers. And there is a lot of allied health professionals. They are listed on the screen. I won't run through them all individually. The WIP practice stream provides primary care practices with more flexibility to respond to local community needs and gaps in services. This includes helping practices to meet the increasingly complex health needs of older people and people living with chronic and complex conditions. It is designed to complement and strengthen existing services, not to replace or duplicate them. So eligible health professional under the WIP practice stream is, as I said, is a nurse practitioner, registered nurse, enrolled nurse, midwife, Aboriginal and Torres Strait Islander health worker, Aboriginal Torres Strait Islander and allied health professional listed in Part B, Section 1.1 of the guidelines. And they also are employed, engaged or otherwise retained by the practice for their time that is not supported by other funding or direct billing of MBS items. And they also need to meet the eligibility requirement in that Part B in Section 1.1 of the eligible health professional. So I do have that referenced in on the back slide, but we will go through that throughout the the presentation as well. So applying for the Workforce Incentive Program, the practice stream, the easiest way to do that is by logging into Proda to access HPOS, and by selecting My Programs, then the WIP Online. And in the WIP practice stream online, you select the Apply Online Now. Or you can also apply for the WIP practice stream using your incentive application form, which is your IP001 form. So you can link your practice incentive program, the PIP, and your workforce incentive program, which is your WIP, the practice stream, practice details together. So if your practice participates in both the practice incentive program and the workforce incentive program practice stream, you can become a PIP consenting practice. So as a PIP consenting practice, your practice ID numbers will be identical, and you'll only need to make updates to your PIP profile. You won't need to make the same update to your WIP practice stream profile. So to become a PIP consenting, when you apply for your WIP practice stream, you just select yes to consent to using the PIP practice information and provide your approved PIP practice ID number. So to make sure your PIP data is correct when you're going through the application, you can update your PIP data using your PIP online before you submit your WIP practice stream application. So if you are already approved for PIP and WIP practice stream and your practice IDs don't match, you can also link them as well. So to do this, the owner or the authorised contact person of your practice needs to give Services Australia both practice IDs, and that can be done by sending them a written request on a company letterhead and just emailing it to the WIP practice at servicesaustralia.gov.au. So it is pretty straightforward. So practices have the flexibility to decide the type of eligible health professional or a combination of health professionals to engage and how to engage them. So practices should consider the health needs of the community, any gaps in services or access to services in their community, and which eligible health professionals will support their practice to deliver team-based and multidisciplinary care. So examples of gaps could include limited or no access to a particular health service in the community, limited or no access to particular community members, or disadvantaged community members that cannot afford alternative services delivered outside of general practice. So the incentive payment is intended to help practices with the cost of engaging eligible health professionals. It doesn't cover the whole cost of engaging eligible health professionals, but practices should ensure that eligible health professionals are paid at or above the relevant award wage for the hours that they are engaged. So the WIP practice stream eligible practices can engage eligible health professionals as part of the multidisciplinary team through direct, contracted or casual employment. The practice decides the form of engagement with the eligible health professional, and private providers may enter into an agreement with the practice. However, only hours worked under that agreement can be claimed under the program. So hours claimed under the program cannot then be claimed by the private provider through the Medicare Benefit Schedule services unless an exemption applies. So practices are not eligible to claim payment for any hours where they already receive financial support to employ or engage an eligible health professional, or if the financial support covers the services performed by the eligible health professional. This includes Australian, state or territory government funding, other private funding, so example funding from a parent organisation, or funding from other incentive programs. So the Health Insurance Act Section 19 states that Medicare benefits not payable in respect of certain professional services. So number 2, unless the minister otherwise directs a Medicare benefit is not payable in respect of the professional service that has been rendered or on behalf of or under the arrangement with the Commonwealth, a state, or a local governing body or an authority established by the law of the Commonwealth, a law of the state, or a law of the internal territory. So this means that practices that employ or engage the services of a nurse practitioner, a midwife with an endorsement for scheduled medicines, allied health professional, Aboriginal or Torres Strait Islander health worker or health practitioner with their own provider number are not eligible to claim a WIP practice stream incentives for any time that those health professionals spend on the relevant Medicare benefit schedule services. So this does not apply to Aboriginal medical services, Aboriginal community controlled health services, or a state or territory government health clinic in a rural and remote communities that have an exemption under Section 19(2) of the Health Insurance Act, or receive funding for Aboriginal and Torres Strait Islander health workers, Aboriginal or Torres Strait Islander health practitioners, or allied health professionals through health. So I do have the link there to the legislation, so it's always handy to have a read of that as well. So the maximum incentive amounts an eligible practice can receive is $32,500 per quarter or $130,000 per year. That's before rural loadings and indexation are applied. So indexation will be applied each year. Um, and the amount paid to each eligible general practice depends on the practice size measured in standardized whole patient equivalent, so your SWIPE, and your practice location, the type of practice, the type of eligible health professionals engaged, average weekly hours worked by eligible health professionals at the practice over the quarter, and loadings applicable. So loading by the modified Monash region and the Department of Veterans Affairs concession status. So if a practice meets the eligibility criteria, payment amounts will be calculated by Services Australia following the submission and the approval of the application. So just looking at the calculating the standardized whole patient equivalent. So the SWIPE value is a calculation of the practice size. It is the sum of the fractions of care a practice provides to each of its patients, weighted for the age and the gender of each patient. As a guide, the average full-time general practitioner has a SWIPE value of around 1,000 annually. So Services Australia will work out the SWIPE value using both eligible Medicare and DVA services provided to patients attending the practice during the reference period. So a weighting for the age and gender of each patient is then calculated. The SWIPE value is calculated using a rolling historical 12-month reference period, which starts 16 months prior to the payment quarter. So eligible services provided by both GPs and nurse practitioners are included in the SWIPE value of the practice. So if a practitioner uses the provider number of another practitioner when they bill a service, this is known as a payee provider arrangement. So for the services to be included in the SWIPE value, the payee provider's details must be registered in the WIP practice stream at the practice location the service is provided at. So when the practitioner joins or leaves a practice or extends their provider number at the location, the practice must notify Services Australia. The provider number will be updated or included in your practice profile. And the start and end dates of the practitioners who work in the practice determine the services included in the practice's SWIPE value calculation as well. So the SWIPE value of the practice is calculated in 3 steps. So you have the calculation of the whole patient equivalent for each patient, and that's the fraction of care provided by the practice to each patient, and that's calculated. So the total care for each patient equals 1.0, and this is known as the whole patient equivalent. So the whole patient equivalent is based on GP and other non-referred consultation items in the MBS, and it uses the value rather than the number of consultations per patient. We then have the weighting of the whole patient equivalent, and the whole patient equivalent is weighted for the age and the gender of each patient to become the swipey value. So the weighting recognizes that people need a different amount of care and at different stages in their life. And the amount of care differs for males and females, and the weighting factors are revised each quarter. Then we have the standardized whole patient equivalent value. So the individual swipey values are added together to determine the total swipey value of the practice. So for the purpose of calculating the WIP practice stream payment, the swipey values of the Aboriginal Medical Services and the Aboriginal Community Controlled Health Services will be increased by 50%, and the practice's swipey value is capped at a maximum of 4,000 each quarter. So that's it's a lot to take in. It is quite confusing, but I have got it listed there, and you will all get a copy of these slides to go back to. So what are the types of payments under the the WIP practice stream? So they are the quarterly incentive payments, you've got the quarterly rural loading payments, and you've got your annual DVA loading payments. So Services Australia calculate and administer the payments for the Department of Health and Aged Care, and each quarter in February, May, August, and November. So eligible practices will receive the quarterly incentive payment and the rural loading payment, if applicable, combined in the one transaction each quarter. So practices located in MMM 3 to 7 are eligible for a quarterly rural loading payment in addition to the quarterly incentive payment amount. So the loading is a percentage of the quarterly incentive payment, and it is determined by the main location of the practice. So the WIP practice stream rural loading percentages are 30% for MMM3, 40% for MM4 to 5, and 60% for MM6 to 7. So each quarterly payment, Services Australia provides participating practices with the WIP practice stream quarterly payment advice letter. And this letter itemises the total amount provided to the practice under each payment type applicable for that quarter. And the annual DVA loading amounts are provided in the August quarterly payment advice. So looking at the DVA loading, practices receive the WIP practice stream payment, and providing eligible GP services to DVA Gold Card holders are eligible for an annual payment for each veteran. So Services Australia will identify these practices and make payments annually in the August quarter. So the DVA loading is based on the number of Gold Card holders who receive an in-room consultation in an eligible practice each year. So an amount is paid for each DVA Gold Card holder regardless of the practice location, the nursing qualifications, or the number of nurses in the practice. So there is also no limit on the number of DVA loadings paid per practice. So services must be provided by a GP or a fellow of the RACGP or the Australian College of Rural and Remote Medicine. So non-vocationally registered general practitioners don't meet the definition of GPs for the purpose of the DVA loading. So when a DVA Gold Card holder goes to more than one practice each year, the DVA loading is shared across practices based on the percentage of total consultation fees paid. So to be eligible to participate in the WIP practice stream, A general practice including Aboriginal medical services and Aboriginal community controlled health services must meet all of the following requirements. So they must be a general practice as defined by the Royal Australian College of General Practitioners, so RACGP. They must employ a full or part-time GP and be an open practice as defined by the WIP practice stream. They must be accredited or registered for accreditation and as a general practice against the RACGP standards for general practices. And the accreditation must be current at the point in time date of each payment quarter to be eligible for payment. Um, if registered for accreditation, practices must achieve accreditation against the RACGP standards within 12 months of being approved in the WIP practice stream, or within 12 months of being approved in the practice incentive program if it is a PIP consenting practice, and maintain their accreditation thereafter. So if the practice is a PIP consenting practice, it must must remain eligible in the PIP, maintain at least $10 million in public liability insurance cover for the main location and each additional practice locations. But just remember that legal liability is not public liability. They must make sure that general practitioners and health professionals have the required professional indemnity insurance cover as set out by the respective national board's registration standards, the professional indemnity insurance arrangements, and employ or engage both services of an eligible health professional. Um, if the practice relocates or closes for a period of time, the practice must advise Services Australia of any changes to the practice arrangements within 7 calendar days, or at least 7 calendar days before the relevant point in time period, whichever date is first. And changes to the practice arrangements include like GPs leaving or joining a practice, changes to an authorised contact person for the practice, and changes in hours worked by each eligible health professional, or changes to their employment status. A practice can notify Services Australia by submitting an incentive program change of practice details form. That's your IP005 form, along with the required supporting documents, or update their details through health professional online service for any changes to the practice arrangements. For relocation changes, they can provide an updated accreditation certificate showing the new location to Services Australia within 6 months of that relocation as well. So some services and activities are not eligible to receive payments under the WIP practice stream. So the following services are not eligible, and that is the medical deputising services that directly arrange for medical practitioners to provide after hours services to patients of practice principals during the absence of or at the request of the practice principals, and after hours services that provide care outside of normal opening hours of a general practice. And this applies whether or not the service deputises for other general practices as well, and the care is provided physically within or outside of the practice. General practices that work from multiple locations can apply for the WIP practice stream as a single practice if they meet the eligibility requirements. So practices need to nominate the main practice location, and the main practice location should be the one that provides the most Medicare benefit schedule services per annum. So additional practice locations are called practice branches, and eligibility for and calculation of the rural loading is applied to the main practice location. Excuse me. If eligible, um, a general practice branch must provide MBS services. They have one or more general practitioners who provide MBS services at both the main practice location and the practice branch, and maintain at least $10 million in public liability cover, and ensure that the practitioners and eligible health professionals have and maintain their indemnity cover. So practice branches that provide less than 3,000 MBS services per annum don't need to be accredited to participate. But when a practice branch reaches the 3,000 MBS services per annum, they must register for accreditation in their own right, and the practice branch will have 12 months to be assessed and to achieve accreditation from the approved accrediting agency. So practices must complete and submit your quarterly confirmation statements each quarter before the WIP practice stream payments can be released. So Services Australia will send your quarterly confirmation statement to all approved WIP practice stream practices each quarter, except for the first quarter that the practice is approved for the program. So practices with a health professional online service account they can receive their quarterly confirmation statement each quarter through HPOS by choosing to receive online notifications. The fastest and easiest way to receive and confirm your quarterly confirmation statement is through HPOS, and practices should receive that statement by the 15th day of the point in time month. So to receive your payment, you must review, update and confirm your quarterly confirmation statement, and your statement notices are generated on the first day of that point in time month. So for example, November quarterly confirmation statement notices will be generated on the 1st of October, and your quarterly confirmation statement notices are issued to practices for review between the days 1 and 15 of each point in time month. So if you confirm your quarterly confirmation statement via the health professional online services, you have up until that point in time um, assessment of eligibility date to confirm the accuracy. So if you submit your quarterly confirmation statement to Services Australia for manual processing, it must be submitted at least 7 days before that point in time date. So for example, for the November quarter, you have up until the 24th of October to submit it manually. So once received, the statement will be assessed for payment, and where eligible, the payment will be released. So if a practice does not return a fully completed quarterly confirmation statement by the point in time, the practice's payment will be withheld and until that they receive that statement through. So if the practice's payment has been withheld, Services Australia will advise the practice in writing about the information that is required for payments to be released. Where payments have been $0 or withheld for 3 consecutive payment quarters, the practice may be withdrawn from the WIP practice stream and incentive payments will be ceased. So withdrawn practices may choose to apply to rejoin at the WIP practice stream, and the practices must meet all eligibility criteria, and any previous withheld payments are forfeited. So where a practitioner joins or extends their provider number at a location, keeping their details up to date through HPOS will ensure that eligible services they provide are included in the practice's SWIPE value calculation, and most changes made through HPOS are effective immediately and can be made up to and on the relevant point in time date. So changes cannot be made to the practitioner details and payments after the practice has confirmed your quarterly confirmation statement. So practices must confirm the type of health professional that they engage and the hours that they have worked per week on average within each quarter. And this is done through your quarterly confirmation statement. So when reporting hours worked by eligible health professionals in the quarterly confirmation statement, you must report the average weekly hours worked for each individual health professional for the relevant quarter, but do not report the total hours worked. You need to ensure that hours are reported as a separate entry for each eligible health professional, not the total together, and reported as one entry. So include the identifier type and number, so your APRA number or your HPII number. And if you don't have an identifier, you just select not reported. Any enrolled nurse hours to be included in the payment calculation must also include documented supervisory arrangements by a registered nurse or a nurse practitioner as well. So confirming your WIP quarterly confirmation statement in HPOS, here is just a summary of services Australia have got. They've got a really great fact sheet, as you can see there on the right of your screen, and that steps you through how to submit your quarterly confirmation statement. So as I said previously, it just has to be, you'll receive your statement on the 15th day of that point in time month. And then you would go through, check that it's all okay, and then you must resubmit it through there as well. So I won't go through all that with you. There is a link there to that summary sheet. So this table provides examples of your annual incentive amounts that the practice may be eligible to receive based on the practice SWIPE value and the minimum hours that must be worked by eligible health professionals to receive the maximum payment amount. So a practice may be eligible to receive incentive payments of 32,500 per year per SWIPE value of 1,000 mental blank, 1,000 swipes where a nurse practitioner, a registered nurse, midwife, and or a allied health professional work a combined total of at least 12 hours and 40 minutes per week, or they can get 16,250 per year per SWIPE value of 1,000, where a supervised enrolled nurse, Aboriginal or Torres Strait Islander health worker or Aboriginal and Torres Strait Islander health practitioner work a combined total of at least 12 hours and 40 minutes per week. So where a practice has not engaged a health professional for the minimum amount of hours to receive the maximum payment for their SWIPE value, they may be eligible to receive a proportion of the maximum payment. So the payment can include a combination of components for eligible health professional hours. And if a practice uses a combination of services of different eligible health professionals, those eligible for a higher incentive of the 32,500 per 1,000 SWIPE value will be calculated first. And the maximum incentive amount a single practice can receive prior to rural loading is 32,500 per quarter or 130,000 per annum with an indexation applied. So practices may also be eligible for the rural loading and or the DVA loading. So practices can only claim hours worked by eligible health professionals employed or engaged by the practice. And if eligible health professionals are paid leave during the quarter, these hours can be included in the practice's average weekly hours. So where leave is taken at half pay, reported hours must reflect this. So that is half pay equals half the hours, and unpaid leave or leave paid without, um, leave paid out once a health professional ceases working at the practice cannot be claimed. Practices need to calculate the average weekly hours worked, not the total hours worked. So per quarter for each eligible health professional. So for the WIP practice stream, the number of hours a full-time eligible health professional works is equivalent to 38 hours per week. So for eligible health professionals not working full-time, average weekly hours are calculated by dividing the sum of the total hours worked by that health professional for the entire payment quarter by 13 weeks. So on the screen there, I've just got an example calculated there. So a nurse is engaged for 15 hours per week for 4 weeks and 20 hours per week for 9 weeks. So the calculation would be your 15 by 4 weeks, and then your 20 hours by your 9 and divide it by your 13 weeks. So that gives you 18.46 average weekly hours. But then the minutes must be converted from the percentage of the hours to actual minutes. So you can do this by taking the decimal place of the 0.46 and multiplying that by your 60 minutes, which rounds it to your 28 minutes. So your calculation would be 0.46 times 60, which gives you the 28. Sounding a bit like a maths teacher, aren't I? This example will then be reported in your quarterly confirmation statement as 18.28 hours and minutes. So practices must keep documented evidence of the hours worked by each eligible health professional for compliance purposes. A practice will be given a grace period to replace an eligible health professional that was funded through the practice stream before eligibility for the program is affected. So 21 days or 45 days, like calendar days, if, 45 calendar days if the practice is an Aboriginal medical service or Aboriginal community controlled service and eligible to receive rural loading based on the MMM geographical classification. If a practice can't replace the eligible health professional within the applicable grace period, the practice must notify Services Australia of the change in circumstances at least 7 calendar days before your point in time. Oops, sorry, that's not moving forward. Okay, here are two other examples. So I've got scenario one. So for a registered nurse, so practice A has a SWIPE value of 4,000 and employs a registered nurse for an average of 38 hours per week. The practice is located in an MMM1 area and therefore is not entitled to receive rural loading. So practice A is eligible to receive an incentive payment of 97,500 per year or $24,375 per quarter. Scenario two, so registered nurse and allied health professional in a rural area. Practice B has a SWIPE value of 3,000 and employs a registered nurse for an average of 25 hours per week. A psychologist for an average of 8 hours, and a pharmacist for an average of 8 hours. So the practice is located in MMM6 and is therefore entitled to rural loading in addition to the incentive payment. So practice B is eligible to receive an incentive payment of 97,500 per year. The maximum incentive amount for an organisation with a SIPE value of 3,000 plus the rural loading of 60%. And that gives 156,000 per year or 39,000 per quarter. So we are getting told regularly how hard it is to recruit GPs. So this could be something that you could work towards in the interim, because if you look at your SWIPE values, do your calculation on how much you could receive through your incentive, tie it in with your PenCat and just look at a different model. We're always happy to help you work through this. So just ensure the integrity of your WIP practice stream. So health conducts compliance activities, including audits, to verify that practices are complying with the WIP practice stream eligibility requirements and claims for payments. So this may include practice visits or a desktop review of practice documents. So as a recipient of the WIP practice stream payments, practices may be periodically approached to provide additional data or information relevant to the program. So the provision of this information is to support program monitoring, evaluation, compliance, research, and to inform policy development. So if requested, practices must be able to provide the following evidence to support its eligibility and claims for payment. And that evidence is evidence of registration, um, for self-regulated allied health professional, evidence that they are eligible to be practicing member of their professional association, evidence of the hours worked. So, for example, this could be timesheets, evidence of documented supervisory arrangements for an enrolled nurse, confirmation of details contained in your quarterly confirmation statement, copies of public liability insurance, including the amount covered, and copies of professional indemnity insurance for all GPs and eligible health professionals. So just bear in mind that copies of evidence should be kept on practice files for a minimum of 6 years. So if the GP, leaves the practice and an audit is conducted for that time when the practitioner was at the practice will still need to provide evidence that the professional indemnity insurance for that practitioner was maintained during their employment. So if a practice cannot provide that information to substantiate the eligibility and claims for payments, previous WIP practice stream payments for up to 6 years may be recovered. So if a practice receives PIP payments, these payments may also be recovered if the practice is found to be non-compliant with the eligibility requirements for accreditation, public liability, or professional indemnity of the WIP practice stream. And lastly, this presentation is all been referenced here in the resource links. But for all inquiries about payments, please contact Services Australia, and I have those details listed there on the screen. So that was really comprehensive and a lot to take in. But you will get a copy of these slides, and I might stop sharing my screen now. And I'll invite everyone back on screen, and we might take some questions if we've got them. I'll head over to you, Lee, now.
Thank you very much for that, Heidi. Now
You're welcome.
I'm looking at the questions and got nothing popping up
Have
yet.
we?
So
Oh, okay. I thought we might have had lots of questions.
I think your
So the ladies?
presentation was far too comprehensive, Heidi. You've
Yeah, it
left
was a lot to
no.
get through, wasn't it?
You've
We
left no
do
stone
have two.
unturned.
We do have two questions actually in the
Oh, there are.
question box.
Oh, so technical issue then, because I'm not seeing them.
Oh, okay. I'll read it out for you, Heidi. Let me just go to the first one.
Yeah, I can't see
Screen.
them either, Jen. We
Oh,
can't see
okay.
you either.
I haven't turned my camera on.
Oh, okay.
But I am now. So the first question, for example, if the nurse is away on holiday, you can't include those hours. If the nurse works overtime, you can include those hours?
Oops, I've just lost you. Hang on a sec. Did the department want to answer those questions?
Hi, Heidi. It's Tessa Pascoe here. So look, I think the key here is to think about it being average hours of work over the week. And so that does allow for that flexibility if someone's on leave or if they're picking up extra hours. So you need to take it over those 12 weeks for that quarter. What is their average number of hours that have been worked and apply it as a weekly average hour?
Thank
I hope that
you.
answers the question.
Yeah, thank you.
Thank you, Tessa. Yes, I'm just going to hand over to our colleague, Deborah.
Oh, hi, it's Deborah. I'm one of the project officers on the WIP program. I think I can see where the question comes from, Claire. For example, on the yellow how-to sheet that Heidi shared on the screen, it does actually talk about actual average weekly hours like Tessa was referring to, but it does have an area there where if you were to update your health professional, it does talk about contracted hours being recorded when you update that section. So I can see where it might be confusing that you do record contracted hours, but in actual fact, it's the hours worked average that it's paid on. Does that make sense? Yeah, I can see where the confusion would come in.
So can I just jump in there? So thinking about contracted hours. So if we're saying we're talking about a nurse, for example, they might be on a contracted hours of 20 hours a week. But as part of that 20 hours, if they're actually claiming MBS, you wouldn't be claiming those hours that they're actually doing work on MBS items. So you'd be removing those. What is the average hours there off that? And then what is the remainder is what you'd be claiming on WIP. So that's where your contracting might be different to what you actually claim on WIP. You actually have to think about removing where they have been supported through other financial means in their activities and only including those where they're not getting any other financial support, obviously except for those in those section 19.2 direction supported organisations. Otherwise, it's just the hours that they're actually not getting any funded support elsewhere, and that's where they'll be doing their average hours.
Oh, that's great, Tessa. Thanks for clarifying that.
Yeah, thank you.
So
Okay,
we
Lee,
have a second question?
have you been able to find the questions, Lee?
They're not popping up on my end,
No,
I'm
we
afraid.
can't see them. Yeah.
Oh, okay. I don't know why that is. There is another question. If RN's already working in a Triple M 4 to 5 area, are they automatically in WIP stream or should they apply for these incentives?
I think I might have an attempt to answer that one as well. So
Lovely.
you will have to be thinking about if they're working in a 4 or 5 area, area, are they linked to a practice? The main practice location. What is that main practice location? And then that's where they would need to be included on that in that their work actually being listed and their average hours of work being listed for that practice, and then that would actually be considered and of course being confirmed through that quarterly confirmation statement, those average hours. So it really comes down to where is the main practice actually listed for the WIP practice stream.
Thanks. That's quite clear. Did we
Hopefully
have
that
any more,
answers
Jen?
the questions. Yeah, are there any more?
No, there are not any more. There's
Does
one more.
anyone,
This
want to
is
put some questions in? It's so nice to have you ladies here.
it is.
But it sounds like you're going to get off the hook quite easily.
Thanks, Heidi. And can I just say what a wonderful job you did on presenting that information? It is quite complex, so thank you. You've brought in a lot of
Thank
the
you.
key elements, and
Thanks.
including thinking about where the main practice is, but also that about making sure that your doctors who are claiming and nurse practitioners who are claiming the MBS are actually listed under the WIP practice stream through HPOS, because that linkage really does influence that swappy count. And we find that's probably where a couple of practices do miss out.
Mm. There has been another question that has come through from that same RN that asked the previous question, can WIP be applied for? So I might get you to contact them, Deb. They're from the Hunter area, so that's great. I'm just double checking.
If there's no other questions, maybe can I throw one into the mix?
Yes,
Sure can.
please.
All right, Tessa. I noticed that for practice pharmacists, they must be non-dispensing practice pharmacists. So that's quite clearly spelled out. Is there any distinction between whether that the definition of dispensing is PBS dispensing or non-PBS dispensing?
That's a very good question. Again, what we're going to, and I don't know, I have an exact answer to that, so I might just see if Mapara, do you know the answer to that?
No, I don't actually, Tessa, but I'm trying to see if it says it somewhere in the
Because we haven't
guidelines.
stated in there that it has to be a PBS dispensing. It's just
Yeah,
it has to be a non-dispensing. So I think what you're looking at there is if you've got a pharmacist on site, and we know that there are some Aboriginal community controlled health organisations that are dispensing medication. But this is, again, what you're including here is the hours of work for a particular activity or health professional and what they're doing. And so if you've got a pharmacist there and they're doing, 50% of their time is dispensing, then you wouldn't include those hours. But if they're doing work on doing, I know they do sort of pharmacy like home medicine reviews or etc. If they're doing that type of work, so it's not dispensing, but it's actually looking at, the compatibility of their medications and whatever else, that could be included in their average hours.
So
As
if
long as
they
you're not
were
claiming a medication review. Is that correct?
including
So they'd
MBS,
be
That's right.
doing
MBS
a
medication review.
review, but they're not claiming the MBS.
Okay.
That's right.
So in other words, if the pharmacist is whether or not they're dispensing PBS medications or non-PBS medications, that still those hours would or cannot be included under WIPPS.
That's right.
Got it. Thanks. So just a thought that came to mind. So thanks for that. Are we still in a question-free zone at the moment? I'm going to assume that we are then. Well, we might.
I'm just checking. Let me. I can't see. Yeah, no, there's no more questions. Yeah.
I think the key elements to take away are just making sure that you do understand like how to calculate your hours, and just making sure that you do keep in mind like your MBA, like if you're employing someone, making sure that you remove those hours that are related to MBS services. How would you go, and I know I'm putting you on the spot here, Tessa, but how do you go when you are claiming your nurse item numbers like your 10997s? Does that impact on like hours, like when you're calculating your hours?
Well, again, if they're claiming they're through the MBS, they're not included in their hours of work. And so, again, I understand that the challenge here of doing what's an average hour. So, if they probably need to look across those 12 weeks and say on a weekly basis, I'm usually claiming this many items, but it takes this amount of time. So we haven't equated time to the item numbers. That you'll need to at the practice level consider how long does a nurse take to undertake those activities, and remove that from the count of the average hours.
So even though those 10997s are billed under the GP provider number, but they're done by the nurse, would that still reflect
Because
the
the
hours
nurse is
worked under the MBS?
supporting the, yes,
Okay.
because she's supporting, because if you actually go to those items and have a read, they're saying they're able to be supported by nurses.
Yep.
Um, to
Okay.
support the GP, so they would be included as being an MBS item activity.
Yep. That one's good to know. Yeah.
Sorry, I just wanted to add as well with that one. So the MBS can be counted towards the swap account as well for the practice,
Yep.
and it a nurse can be providing both MBS and non-MBS services. It's just that the same eligible health professional can be providing a combination of both. It's just that only the non-MBS services can be counted for the WIP practice stream. And then the
Sure.
MBS
Okay.
can't. So they can be doing like a proportion of MBS and a proportion of non-MBS as well.
Okay. Thanks for clarifying that. No more questions, Jen?
No, there aren't any more. Lee, did you want to ask anything else?
I do, but maybe it's not appropriate. So I guess maybe I'll make a little comment here, which is to say that I think the general principle of WIPPS is great. I mean, I love the idea of uh, any mechanism which can truly increase the multidisciplinary nature of general practice. I think this is it's an admirable goal and one that we need to take primary care to where it needs to be to face the challenges that primary care currently faces. Um, it would be lovely, and here I guess I'd just be pointing towards I think a comment made by Michael Wright last week to say that if there was even more funding available for WIPPS, that'd be welcomed. That'd be fantastic. Just a comment, not a question.
Thank you. And can I just probably here's an opportunity too to say that for many of you, you'll be aware that we undertook a review of the general practice incentives last year, and there is actually a report on that that is available on the department's website if anyone would like to have a read of that and the recommendations that were made as part of that. And certainly goes to your thoughts there about the benefits of that of the multidisciplinary team. So read for anyone.
Thank you very much, everyone. Thank you so much, Tessa and Mapara, for coming, and Heidi for your wonderful presentation as always. Very thorough. And Lee, thank you for giving up your time tonight and coming. Don't forget to fill out the evaluation. We're getting lots of hand claps, Heidi. So that's fantastic. And don't forget that we will upload a copy of the webinar and a PDF copy of the slides into the Education Library onto the website. All right, the next session is it's on the 20th of May, which is a Tuesday night as well. So that's next Tuesday. So hopefully you'll see me all again then. Thank you.
Can I just say, sorry, Jen, before
Yeah.
we go, if
Hmm.
people do have any questions, they think of them later on tonight, just email through and we can always reach out to the Department of Health and get clarification, or the details were on that last slide for you to contact them directly as well. So, and thanks again, ladies, for joining us tonight. It was great. And thanks, Lee. That was really good for you to support as well. So, and thanks, Jenny and Deb.
Thank you. Good
Thanks,
night.
everyone.
Good
Thanks.
night.